Hello, welcome back to this tutoring session. I'm your host and tutor, Annalise Garrison. And today, for our critical thinking, ladies and gentlemen, we're going to learn critical thinking skills today. And for today, I know that you guys always want to do airway breathing circulation, Don't do that. That's going to get you in more trouble. Usually, it's going to get you to pick the wrong answer. What I'd rather you do is stable versus unstable. Okay? What makes a person stable? Number one, if you see the word stable in the question, that person is stable. If you see the word unstable, the person is obviously unstable. So just look for the word stable. That'll tell you if they're stable or not. Okay? Here's some other cues. Number two, if they were admitted to the hospital greater than 24 hours ago, the patient is stable. If they were admitted less than 24 hours ago, the patient is unstable. Number three, does the person have a chronic illness versus an acute illness, right? Does the person have COPD, which is a chronic respiratory condition, versus appendicitis, which happens suddenly, right? Appendicitis would be unstable or acute, right? The COPD would be stable or chronic. So chronic conditions are stable, acute conditions are unstable and should be seen first. You see? This works for who would the nurse see first. Okay? If they are getting local or regional anesthesia, the person is considered stable. All right? If the person is getting general anesthesia, the person is considered unstable. So, who would you see first? Always pick the unstable first. Okay? If you see words like the person is ready for discharge or they're going to be discharged versus newly diagnosed or newly admitted, right? The new stuff would be considered unstable. But if they're going to be discharged or to be discharged or whatever, that's considered stable, right? Now, let's talk about assessment here. Now we can delegate unchanged assessments. We can delegate stable assessments. What makes an assessment stable? If there's no changes from your initial assessment, that person is stable. So unchanged assessment would be considered stable. If there's any changes from the original assessment, that person would be considered unstable. And if you see expected findings of the diagnosis, that person is stable. If that finding is expected for that particular diagnosis, don't pick that answer, right? You do see the person first if you see unexpected findings of that diagnosis. All right? Now, let's look at an example of what I'm talking about. And remember these points that you see on the screen. Blue is going to be stable. Red is going to be unstable. So stop it here and take a minute to take notes, and then we will go over a question. I'd like to take this opportunity to invite you to join my Patreon page at the link below. We here at Caring for You Tutoring Services do realize that these are trying times that we are living in. We do realize that your finances may be tight. So consider joining the Patreon page for just $30 a month. Now, for that $30, you will get at least half hour to 1 hour long videos on tips, strategies, on how to take the exams, whether you're taking the HESI, the ATI, or the NCLEX. And also every month we will have a theme, whether that theme be prioritization, critical thinking, whatever that theme may be. So please consider joining the link below. That may be an alternative to getting actual tutoring. So now let's take all that I have talked about with stable versus unstable and use that in a question. Let's look at this question. The nurse has been made aware of the following client situations. The nurse should first see the client: A, the 28-year-old client with pneumonia who is expectorating blood-tinged mucus and is reporting chest pain upon inspiration. B, a 36-year-old client with a pulmonary emboli who is receiving prescribed heparin, sodium infusion, and has a PT which is 1.5 times the control value. C, a 40-year-old client with MS who has ectopia and is experiencing urinary incontinence. Or D, a 47-year-old client who just had a thyroidectomy 1 day post-op and is reporting that the dressing feels tight. Now, before we go further, I want to explain that every exam question, no matter what exam you're taking, whether it's the HESI, ATI, or the NCLEX, every exam question just about has an age, a gender, a diagnosis, and the reason you are taking care of that patient phrase. So we'll call that the caring phrase. So let us look at this question, these answers. One thing I want you to know is that the age and the gender does not matter. We are looking at the diagnosis and the caring phrase. Okay? Now let's take all that we have learned with stable versus unstable and apply that to these answers. Let's look at answer number 1. A 20-year-old client with pneumonia who is expectorating blood-tinged mucus and is reporting pain upon inspiration. All right, this person is not stable because they are expectorating blood-tinged mucus and they are reporting pain upon inspiration. So although they're not stable, if a person has pneumonia, is this an expected finding of pneumonia or an unexpected finding of pneumonia? And for those of you who have tutored, I've said that 7 out of 10 times pain is not the answer on the NCLEX unless we cause the pain, unless the medical profession caused the pain. So, this is an expected finding of pneumonia, right? Therefore, we do not pick it. Remember that if it is an expected finding, it is a stable individual. All right. A 36-year-old client with pulmonary embolism, that's your diagnosis, but the reason we're caring for this person is who is receiving prescribed heparin sodium infusion and has a PT which is 1.5 times the control value. So we are caring for this person's infusion. The question is the PT an expected finding or a non-expected finding? It is an expected finding. So, what does that make this person? That makes this person stable. We are caring for the heparin infusion. Now, if anything went wrong with the heparin infusion, we would need to see this individual first. But given the information that we have, there's nothing wrong with the heparin infusion at this point in time. Therefore, don't pick the answer because the PT is normal. A normal value for this individual. Okay? Let's look at C. A 40-year-old client with MS who has ectopia and is experiencing urinary incontinence. Now, MS is the diagnosis. Is that a stable condition or an unstable condition? MS is a chronic condition, so this would be a stable condition, right? Versus the pneumonia, which is unstable, right? It's unstable because pneumonia is not a chronic condition. MS is a chronic condition. So, people with MS usually do have trouble with their kidneys, don't they? Right? So, because MS is a chronic condition, don't pick it. We want to pick the most unstable individual first in this case. Let's look at D. A 47-year-old client, okay, that's the age, we don't need to pay attention to the age, who just had a thyroidectomy 1 day post-op. So, thyroidectomy, that is not a chronic illness, right? So, a thyroidectomy 1 day post-op and is reporting that the dressing feels tight. Okay, this person had a thyroidectomy what? 1 day ago, 24 hours ago. So this person should be stable, right? But is it normal for the dressing to feel tight 1 day post-op? No, this is a unexpected finding. So since this is a unexpected finding, this person needs to be checked first. All right? Now let's go over the answers again. We did not pick A because for pneumonia, it isn't expected they have pneumonia. So this is an expected finding, and of course they're going to have pain. Pain is an expected finding with pneumonia. Don't pick it. A 36-year-old with a pulmonary emboli who was receiving prescribed heparin, sodium infusion, and the PT, and has a PT which is 1.5 times the control value. This is an expected finding with somebody who is receiving heparin. A 40-year-old client with MS who has ectopia. Ectopia, what's ectopia? A displaced organ, right? This is something chronic. So if their kidney is displaced, of course they're going to have kidney problems. This is an expected finding. So we want to check on D because the dressing feels tight should not be happening. A tight dressing could be a sign of that the morning nurse just put the dressing on too tight. Simple as that. Or it could be an infection. So let's check the dressing. All right, very good. Now, for those of you who joined my Patreon page, I'm going to continue on for another 45 minutes. Let's look at the next question. The nurse has been made aware of the following client situations. The nurse should first assess the client who is being treated for gastro bleeding and is reporting having tarry stool, has not voided since an indwelling catheter was